Very warm welcome to this edition of our live program, Let's Talk Health. We're talking on oncology queries today. I'm Nidhi Kumar and you're watching India Science. Well, India's cumulative COVID 19 vaccination coverage exceeds 189 crores today. India reported 3,157 new COVID cases. More than 4 lakh vaccine doses have been administered in the last 24 hours. And the recovery rate currently stands at 98.74%. As COVID 19 continues to surge in the country, COVID related queries are on the go. People are speculating about health problems, and we get your queries on oncology today. In this program, where we take your questions from Facebook and YouTube Live, we are joined today by the very well known Dr. Suman Bhaskar, Professor of Radiation Oncology at the All India Institute of Medical Sciences, New Delhi. Namaskar and welcome to India Science. Thank you for joining us today, ma'am.
Namaskar.
My first question to you, ma'am, would be to tell our viewers about the current cancer scenario in India in view of the new variant, which is the XC variant, and how do you prioritize cancer management at the hospital in such times? Is there any specific protocol, ma'am?
Yes. During the current times, when we are dealing with newer variants of the COVID-19, currently the XC variant, which is a hybrid variant, supposed to be more 10% more infective than the previous genotype. If you look at the cancer scenario in India, it is no different from the cancer scenario all over the world. So during the last 2 years of pandemic, what we have seen is that the health system, not just in India, but all over the world, was struggling to cope with the COVID-19 pandemic, which is understandably the priority. So on account of this, all other conditions, be it cancer or other non-malignant conditions, other chronic illnesses, all of the illnesses overall have suffered. And I'm not talking about just India. I'm talking about all across the board, all over the world. In fact, from the Western countries, there are data and they have done their analysis, and it has been very clearly shown that health services, especially if we focus at the cancer-related treatment services, they were disrupted to the tune of 50% and even more. We are yet to have our own data, but in the West, the data on cancer mortality during the last 2 years has also come out, and it clearly shows that cancer deaths were far more during last 2 years. But thankfully, at the current time, though we are still having the newer variants and all those things going on, but the health services are more or less at the pre-pandemic level at present. So we are treating the cancer patients as they were treated earlier, with, of course, certain protocols and precautions. Though COVID the cases are increasing every day now, as you said in the intro also, but there is no data to suggest that cancer patients will have more chances of having COVID infection. Although there is evidence that if they contact the virus, then the risk of having more severe infection is increased. So this is the difference. And when it comes to treating COVID infection in cancer patients, the protocols are no different from the non-cancer patients. The treatment guidelines for COVID remain the same, except that alertness towards severe infection needs to be much more enhanced. Secondly, if you ask me about the certain protocols and guidelines during COVID times for cancer treatment, then yes, many scientific organizations during the pandemic came out with guidelines and clear-cut recommendations regarding
administration of cancer treatment. So, but these guidelines are to be decided on case-to-case basis. So not all patients can fit into the same guideline. Each patient has to be individually decided upon, and the key principle is not to delay the treatment as much as possible, to modify the treatment in such a way so that hospitalization can be minimized, hospital visits can be minimized, and sometimes without compromising the outcome. Some treatment protocols regarding chemotherapy or radiation therapy may be tweaked, weighing the risk-benefit ratio vis-a-vis COVID situation. So these are the broader principles at present, and I'm glad to inform that all health services are now resuming, and we are treating as many patients as we used to before the pandemic.
So much for sharing this absolutely valuable information on protocols maintained at the All India Institute of Medical Sciences, Delhi. My second question to you is, what are the common cancers you see, doctor, in your practice in men and women, male and female both? I think we've lost the audio. I'll repeat the question for our viewers. What are the common cancers that we see, doctor, in your practice as in men and women? What are the common cancers that you tend to see? Yes, doctor.
Yes. So the most common cancers that we see among males are the mouth cancers, number one, which we refer to as oral cavity cancers. Then we have lung cancers, and unfortunately, both these cancers are related to usage of tobacco. Then we have cancer of stomach. Then we have cancer of larynx, which is commonly known as the voice box, which is inside the throat and is responsible for our speech. Then we have colorectal cancers and cancers of the food pipe or the esophagus. These are the top most common cancers that we see in Indian patients. When we talk about females, of course, the number one cancer is cancer breast. And the second most important entity here is cervical cancers. That is cancer of the cervical part of the uterus. Then again, in females, we are dealing with the cancer of ovary. Then we have oral cavity cancers, again the mouth cancer, followed by colon and rectum, colorectal cancers, or cancers of the lower parts of the intestine. So the important point here is that majority of the cancers, more than 50% of the cancers in women are breast and cancer combined. And if you look at the total number among both the sexes, majority of the cancers are related to use of tobacco. So we say that tobacco is a single most preventable cause of cancer. If the tobacco usage can be addressed, we can prevent a huge spectrum of cancer in the country.
Absolutely, doctor. Please throw some light on cancer screening and early detection. What are your views?
Okay. So, what is cancer screening? Cancer screening is testing of normal, healthy population in which there are no symptoms, no signs, no disease as such. So, screening is often done for a target population which is at high risk. So, we have to identify a target population and then do screening for the mass level for this target, in which there are no symptoms at present. Unfortunately, when the symptoms are there, the cancer is already spread to some extent. So the whole idea behind screening is to catch it as early as possible, even before the symptoms have occurred, so that a better, more effective, and easier and simpler treatment can be given. What was the second part you said? You asked?
Again, early detection.
Early detection. Okay. So early detection is different from screening. Early detection is when the symptoms have already occurred.
Surfaced. Yes, absolutely. Early detection is when the symptoms have surfaced, is what we're asking Dr. Suman Bhaskar.
Yes.
Yes, ma'am.
So early detection is another very, very important aspect, is the key issue here.
Yes, doctor. We're sorry to be able to, not connect properly in the case of a bad network issue at the other end. You were telling us about early detection. Yes, doctor.
So,
Yes, I can hear you, doctor. You were telling us on early detection.
has developed the symptoms and is being investigated further.
Then there is this concept of early detection comes. So early detection is that the symptoms are caught early and are put on right track, on the right investigations, the access to diagnosis, access to referrals, and access to proper treatment. Early detection is a very important component of cancer care, and early detection is a challenge in our society. In Indian context, early detection is a challenge. It is mainly because of lack of awareness and lack of what we call it health literacy. Health literacy is ability to understand, to grasp, to assess and apply the health related information. But in cancer patient, it is further complicated by a lot of psychosocial issues. And furthermore, the cancer patients, as it is, undergo a lot of psychological and emotional distress. So all these factors combined pose a challenge for early detection.
Absolutely, doctor. We have a YouTube question now coming up from Ashwini from Noida, and he wants to know what age should he start regular mammograms for his elderly sister.
Okay. So mammogram is a screening method for breast cancer, and breast cancer is rising in numbers. More so in past 2-3 decades, there has been a rapid rise in number of breast cases, especially among the urban women. So mammogram is advised after the age of 40. 40 is the time when mammogram screening needs to be initiated. But I would say that mammogram is again a procedure involving X-rays. So before going in for a mammogram, a specialist needs to be consulted. So 40 is the age when mammogram screening can be started. And of course, there is a subset of women who are even more at high risk on account of maybe their genetic changes, on account of the family history of breast cancer in their first degree relatives like the sister or mother. These high risk category patients need more monitoring and better surveillance. So these patients should consult their doctors to start the mammographic screening.
Yes, doctor. The next question to you is, we see most of the malignancies in advanced stages in India. What is the reason for this? I mean, why can't we, sort of get to know earlier? Why is it seen only in the later stages? If you could prize our viewers.
Okay. So what we were just talking regarding early detection. So early detection is an important component. Why we do not get them in early stages? Because we lack in early detections. It is not just the health literacy aspect, it's also the accessibility to treatment, its affordability and availability. So it is a multifaceted problem. Again, it is then complexed by many myths and misconceptions about cancer. So basically, we have to build up awareness and accessibility, and we have to have more robust campaigns regarding cancer awareness, not only among general public but also the primary healthcare worker, to be able to recognize those early signs and refer the patients accordingly for further investigations. So, because of lack of all these things, we end up having late diagnosis. So, right from the first symptom to diagnosis, there is a delay, which then adversely affects the treatment and its outcome. So this is a very basic challenge that we face in our clinics every day.
So we have another YouTube question now coming from Dolly from Delhi, and she says she is going to start radiation next week. So what should she expect, and what could be done perhaps to decrease the fatigue level?
Okay. So, Miss Dolly, you are going to start radiation next week. I'm sure your treating doctors would have given you some information. I would just like to add that radiation is a safe treatment, and if it is dealt with appropriately, you should not have many side effects. Yes, fatigue is a known side effect of radiation, and to combat fatigue, the most important thing is nutrition. So you have to take extra care of nutrition. You should be on, I don't know which condition you are suffering from, so you should be taking high protein diet, and you can further consult a dietitian who are now available, part of the team of the doctors. So you should be on high protein diet. You should be taking a lot of fluids. You should be taking adequate rest, and at the same time, you should be doing some light form of exercises. And yes, to add to the all this in view of the COVID situation, minimize your interaction with people or people outside the family, and keep a good personal hygiene.
Yes, doctor. My next question is, can men get breast cancer?
Surely, men can also get breast cancer. However, it is a very rare situation for men. So, men, particularly at risk, are very elderly men, men who have been on some kind of hormone therapy. It could be because of prostate cancer, in which hormone therapy is given, or it could be on account of family history. If there is already male breast cancer in the family, then other males are at higher risk. And sometimes some genetic conditions like Klinefelter syndromes, etc., also put them at a higher risk for developing breast cancer. The treatment remains the same: surgery, radiation, chemotherapy, as that for women. But in India, it's a very rare condition.
Next question, please.
The next question is on YouTube again, and this comes from Shivam from Ghaziabad, and he wishes to know what is interferon therapy and how does this help? If you could elucidate.
Okay. So, Mr. Shivam, interferon is a immunotherapy. So, as we all know, our bodies have an immune system, and which consists of white blood cells, some tissues, some organs. And whenever there is an attack in form of infection, or whenever there is a mutation and a normal cell turns into a cancer cell, our body invokes an immune response to kill that attack in the form of, which is in the form of a virus or a cancer cell. So this interferon is immunotherapy, which further boosts our own immune system to fight with the cancer cells. So in certain conditions, immunotherapy has shown a lot of benefit and is prescribed. Mostly it is prescribed in addition to chemotherapy. And in particular, certain indications, it is prescribed on its own, and it works very well for kidney cancers, for skin cancers, for lung cancers.
Thank you so much. The next question that I wish to ask you is, what are the common myths that you see in patients about cancer and its investigations? Primarily, it's investigations and treatment.
Okay. So, in a country like ours, where we have an issue of literacy, the social and economic issues, and all other multiple factors are there into play, there are lots and lots of myths and misconceptions around cancer, its investigation, and its treatment. So, if a patient is, even after investigations, if patient is told about the diagnosis, uh, it is many a times they do not accept the diagnosis. They feel that since there is no cancer in the family, so how do we get it? It is not possible. Then there are patients and the family members who feel that this is a contagious disease, so let us isolate the patient completely, and nobody will touch him, nobody will go here near the patient, and the patient during the process gets neglected. Then there is a myth that it is hereditary. If this person has cancer, the cancer will be there in the next generation as well. When it comes to diagnosis, it is a very, very common misconception that if biopsy, which is the mainstay of which clinches the diagnosis, the patients would come and say, no, we don't want biopsy. If you do biopsy, our cancer is going to spread. If you do some surgery, the cancer is going to spread even more. If we take chemotherapy, it's going to be so painful that we will, we are better off with the disease and rather than taking the treatment. So all these misconceptions are rampant in the communities. And to add to the problem, there are unregulated practices where the patients are lured and told that, we will give this some alternative kind of a treatment, some churan, some vibhuti, or some some of these things which are less toxic, and we give guarantee that it will cure you of your cancer. So all these myths and misconceptions around cancer, its diagnosis, its treatment, add to the problem and adversely affect the outcomes in the end. At the end, the patient presents to us with metastasized disease, which is a stage 4 disease, and by then this disease has become incurable.
We have another YouTube question from Nisha, and she writes in from Shadra. Her question is, how is anemia related to cancer, or is it actually related? And what are anemia and cancer like conditions?
Okay. So anemia is when the hemoglobin drops because of suppression of production of your red blood cells. So its connection with cancer is that certain treatments like chemotherapy can sometimes suppress the production of red blood cells, leading to anemia. Then there could be a cancer which can cause a lot of bleeding, like cancer in the stomach or cancer in the intestines can cause bleeding. And on account of that blood loss, patient will present as anemic. Then there could be disease in the kidney or other diseases, cancer or non-cancer, which could affect again the production of the substance called erythropoietin, which again would lead to anemia. So once anemia is there, then it becomes a complication to further treat the patient, because hemoglobin is required to carry oxygen all over the body. So if hemoglobin levels are low, then the treatment outcomes suffer, and anemia needs to be addressed immediately. So anemia can be addressed. It could be also be, I forgot to mention, it could also be because of nutritional reasons. If there is cancer in the throat or in the food pipe and the patient is nutritionally compromised, there are chances that he would be having anemia. So all these causes need to be addressed. Why the anemia is happening? Is it because of nutritional reasons, or is it because of blood loss? In that case, blood bleeding needs to be stopped. So along with all these measures, then there are medicines, iron-rich diet, and iron tablets or iron infusions are to be given to the patient. And if need be, blood transfusions are also required.
Yes, doctor. Yet another YouTube question, this time from Kanpur Satya Prakash, and he wants to know the side effects of chemotherapy. I think this is for all the viewers, and it's a very, very important question, doctor. If you could tell us.
Okay. So with chemotherapy, there is generally a lot of anxiety, as you said, that everybody wants to know that what all side effects will it entail. Of course, chemotherapy comes with its side effects. So do other forms of treatments. No treatment is free of side effects. So side effects would range from minor to major. So chemotherapy, the basic principle of chemotherapy is these are drugs that kill the cancer cells. So in the process, they also kill some healthy cells. So what happens that because of killing of these healthy cells, there are side effects in the body. For example, the cells that that generate hair. When these cells get killed, there is hair loss, and which is a very common side effect of chemotherapy, which is a very much of concern in everybody's mind. But let me tell you, once the chemotherapy stops, the hair comes back. Temporary side effect, and it should not be taken very seriously. The other side effects are nausea, vomiting. Again, these are because the cells lining the intestine and the gastric tract get killed. So, which leads to nausea, it could lead to vomiting, it could lead to oral ulcers, it could lead to diarrhea. And the third important side effect is again immune suppression. So, when there is immune suppression, the blood cell counts get decreased. Uh, this makes the body prone to infections. So it is very important in such scenario to do all the supportive medication along with chemotherapy and protect the patient from any potential infections.
Right, doctor. My next question would be, what is hormone therapy for cancer? Not what is photodynamic therapy and immunotherapy? If you could explain these three, I'll be so grateful.
Yeah. So let us start with hormonal therapy. Hormonal therapy is treatment of cancer by the use of hormones. So there are certain cancers which grow and divide on the basis of the hormonal supply to them. So they are called hormone dependent cancers. So when these cancers are there, we can actually alter their hormonal supply and treat this cancer. So these cancers are usually the prostate cancer, breast cancer. So in these cancers, some hormonal drugs are given to treat the cancer. In photodynamic therapy, that is a combination of drug and some photosensitizing agent in the form of low energy lasers. So this is mainly used for treatment of skin cancers, in which a photosensitizer drug is first given, and on the area where the disease is, lasers are thrown to kill the cancer cells. Third one is immunotherapy.
Yes, ma'am.
I've already told, but I will repeat. Immunotherapy is drugs which boost or modify our own immune system to fight the cancer. So these are the broad terms or what we mean by these.
Absolutely. Doctor, one last question from you that the viewers would like to know about breast cancer and its treatment. What kind of treatment do you generally advise for women in the first stage of breast cancer? And is it okay to go ahead with the surgery?
See, when we talk of treating a patient, so let us be very clear that no two patients can be treated in a similar way. All patients are different and all treatment decisions are to be taken on case to case basis. For early breast cancers, the cure rates are very good and whole lot of treatment options are available. Surgery is a mainstay of treatment, and now there are very good surgical techniques with minimal invasion and provide very good cosmesis and good oncological outcomes. And of course, chemotherapy is often required to treat breast cancers, even in early stages. So, no two patients can be treated in the similar way, and each patient will get a different treatment protocol, and it is best to consult your uh, expert.
Yes, doctor. And on that note, I'd like to thank you, Dr. Suman Bhaskar, for joining us today, sparing your valuable time in educating us. And with this, friends, this is the wrap of this edition of Let's Talk Health. We'll be back with more interesting episodes on Let's Talk Health. Until then, get vaccinated. Use the mask. That's the only way. Stay safe and mask up India. On that note, namaskar. Thank you for watching India Science.